The United States has refused to allow a Paris to Detroit flight to land on its soil. This comes after a passenger from the Ebola-hit Congo boarded the plane in error, reportedly. U.S. entry restrictions aim at limiting the spread of the deadly virus, but it is still not confirmed that the person from Congo was infected by the Ebola virus. The flight was forced to divert towards Canada, reportedly. For American passengers that are traveling from Ebola-hit areas, the U.S. State Department has routed the Washington airport for enhanced screening. Apart from this, the U.S. has also temporarily suspended visa services for Ebola-hit areas.
Objective on Ebola before anything else, and we think it's terrible what's happening there to the people. We've been very involved with DRC on the peace deal with Rwanda and so forth, but our number one thing has to be we can't have it affect the United States. We can't have Ebola cases coming here. So you saw we're now not allowing people to come in. In fact, I think we had a flight last night headed to Detroit that was diverted because we have to protect the American people. So objective number one is to make sure that Ebola never reaches the United States. Objective number two is do what we can to help the people of DRC and neighboring countries so it doesn't spread. And I think we're up to 600 confirmed cases. There are probably more. We'll learn more about it.
The WHO has declared the risk of Ebola virus high in Central Africa. However, the UN Health Agency said the risk remains low globally. This even as the latest surge in Ebola-linked cases has been declared an international health emergency. The WHO added that the virus had likely been spreading for months. The outbreak of the highly contagious hemorrhagic fever was declared in Congo last Friday, remember. Ebola has killed more than 15,000 people in Africa in the past half-century. The 17th Ebola outbreak to hit Congo is already suspected of having caused 139 deaths from around 600 probable cases. And experts saying the numbers are likely to rise further. All right, let's go straight across now to our correspondent Susan Tehrani with us, who's been monitoring those developments. Hi, Susan. Tell us more about the measures that the United States is looking like at right now. We've heard from Marco Rubio, who has made the government's stance, the administration stance, absolutely clear. Also, in the latest on that flight, what are you picking up? As of now, the passenger, whether or not the passenger was infected with Ebola, remains unclear.
Yeah, it does remain unclear. The Center for Disease Control and Prevention announced on Monday that individuals without a U.S. passport will be restricted to coming here into the United States from countries from Congo, South Sudan, Uganda in the last 3 weeks. The restriction is in effect for the next 30 days or so. Regarding that individual, you're absolutely right, Molly. We don't know whether or not that passenger was in fact inflicted or not. We did hear that Montreal Trudeau International Airport directed comments to Air France to see what happened regarding the diversion of that flight, and Air France's spokesperson said that there was no medical emergency on board, and like our airlines, Air France is required to comply with entry requirements of the countries it serves. So that's the latest that we do right now. But it does appear that due to entry restrictions put in place to reduce the risk of Ebola virus, the CDC is saying that the passenger shouldn't have even boarded that plane in the first place.
Right. We'll leave it there for the moment, Susan. Of course, coming back to you as and when there are further updates. That, of course, remains a developing situation, and we will be keeping a very close eye on those developments.